Thank you, Presiding Officer. I thank Fiona Hislop for bringing this motion to the Chamber today to discuss the important issue. In January, I wrote to the Chief Executive of NHS, Lothian, Scotland, expressing the concern of my constituents where they were worried about the lack of end-of-life care at the nearest hospitals, St John's. I also addressed the lack of GP surgeries in the area and that the possible closure of St Michael's would be catastrophic if no alternative palliative and respite care is available. They were also concerned that this may lead to nurses retiring earlier, adding to the overall pressure on the NHS. The original purpose of St Michael's Hospital was to provide a service for the local communities, thanks to the Friends of St Michael's Group's amazing dedication and commitment. I know that for so many of my constituents, St Michael's Hospital is not only vital for providing hospital and crucial end-of-life care, but also acts as a community hub, supporting families with loved ones being cared for at the hospital. The SNP have been in power for the last 16 years, yet the state of health and social care sector has deteriorated due to the chronic underfunding and mismanagement. Local government and the Integrated Joint Board, IJB, in West Lothian have been starved of resources and have been left between a rock and a hard place. St Michael's Hospital is just one example of the current crisis in health and social care in West Lothian. Many of you may have been aware of the public meeting last evening about the privatisation of care homes in West Lothian, where more than 200 local residents turned up. Residents were there to express their concern for the future of social care in West Lothian, and the local residents, they rely so heavily on it. I attended the meeting on behalf of my Lothian Scottish Labour colleagues, and there was a clear frustration and anger toward the insufficient resources and funding for health and social care. This has happened due to cuts made by the Scottish Government that are putting councils under pressure. It is important that all Lothian MSPs meet together now to discuss how we can get extra resources and funding allocated to health and social care in West Lothian, Lothians, and how we can move forward and tackle this ongoing crisis. A cross-party approach to tackling this crisis is essential. Once again, I thank my colleague Fiona Hislop for bringing attention to this issue. I look forward to meeting with my Lothian colleagues soon to deal with this crisis in health and social care in West Lothian. Thank you.